Good afternoon to all of you. I'm going to be presenting about vitamin D levels and proliferative diabetic retinopathy in type 2 diabetes. I work in a diabetic hospital and I have no conflicts of interest or any financial disclosures. All of us are aware that diabetic retinopathy can affect 1 out of 3 people with diabetes. Studies have been done in other ethnic populations that have shown that vitamin D deficiency is associated with DR. But such studies have not been done in Indians so far. So we have done a study to assess whether the role of vitamin D deficiency in the development of diabetic retinopathy, particularly sight-threatening diabetic retinopathy in Indians, particularly because India is already home to over 70 million people with diabetes. So to evaluate the association between vitamin D and the presence and severity of DR, what we did was we did a retrospective study looking at the electronic medical records of our patient after taking ethical committee approval. All the data of our patients who came between 2012 and 15, about 3,000 patients over the age of 18 who had undergone fundus photography and the vitamin D assessment during the same visit. Patients who were not taking any vitamin D supplements, who did not have severe diabetic nephropathy or liver disease were included in the study. And the diabetic retinopathy severity was graded based on the ICDR classification. We define vitamin D deficiency as vitamin D levels less than 20 nanograms per milliliter. This is the baseline characteristics. You can see that between the 3,000 patients, those with DR had the traditional risk factors, that is duration of diabetes was high, they had higher glycated hemoglobin, the albuminuria. If you look at their vitamin D levels, you can see that even in the no DR patients, the vitamin D was only 13.7, whereas those with DR, it was 11.9, which shows that even with patients with no retinopathy also, there was vitamin D deficiency. The vitamin D deficiency was of course higher in those with DR. Looking at the correlation of vitamin D levels, based on the varying severity of DR, we can see that between patients with no DR compared to patients with PDR, we can see that vitamin D levels are declining with increasing severity. You can see the downward grade in the vitamin D levels in the serum based on their retinopathy severity. When we did a multivariate logistic regression analysis after adjusting for various correlates, we found that for those with PDR, vitamin D deficiency increased the risk by 2 times. Any patient who had vitamin D deficiency had twice higher risk for developing PDR. So in this analysis, what we found that was in over 3,000 Indians with type 2 diabetes, they had lower vitamin D levels than those without retinopathy. But however, we also found that vitamin D deficiency itself is quite prevalent in Indians, especially those with diabetes. Earlier studies, what they have shown is that in animal studies, vitamin D calcitriol, it reduced the retinal neovascularization and it also decreased the expression of VEGF. So possibly vitamin D deficiency affects DR at a more severe level when VEGF secretion is at highest. So even after adjusting the glycemic levels and the blood pressure control, we found that some people still develop sight-threatening retinopathy. Possibly it is because of their vitamin D deficiency. So this is probably one of the first studies that has looked at vitamin D deficiency and its association with PDR in Indians. And this is a very large sample, but this is a cross-sectional study. Further evaluation is needed. So to conclude, I would like to say that in Indians with type 2 diabetes, lower vitamin D levels is associated with increased severity of DR. Vitamin D deficiency increases the risk for PDR 2 times. And further studies are definitely needed to see if vitamin D supplement would be helpful in preventing any progression of DR. Thank you.